Hi, it's Birch here again from Blemish Clinic. I'm with Professor Val Edwards-Jones, microbiologist. We're talking about masks again. Because masks are a massive big issue at the moment and very difficult to get hold of. There's so many out there, you're probably not really sure which ones you should be having or which you can actually get. You need to be getting something that's licensed, that's got medical license, that's guaranteed to stop viral infections and for infections to get through to protect others from you as well. So can we talk a little bit more, Val, on masks again?
Well, there's lots of different types of masks. The ones that you frequently see in healthcare workers have the strings behind, and they're usually very thin, made out of paper. They do have to pass regulations to get approved, but they're usually one wear, so you'll wear it for one patient for about 5 or 6 minutes and you'll discard the mask appropriately. But there are other masks, because obviously some of these nurses and doctors have to get gowned up and then they're in these masks
with the respirators.
With a respirator. Now they're quite different. The first masks I talked about, you can breathe through them relatively easily, but these other masks, it's more difficult to breathe through, so you do have to have proper respiration and aeration.
And they have to be really, really tight, so no air can come out from the side. There's been so many things on masks over the years. I did a study many, many years ago looking at masks, what maybe beauty therapists would wear for doing nails. They last less than about 6 minutes. So to buy really cheap masks that are not that that are out of paper, they're not going to last long, and you've got no protection virtually with those. So you do need to be having things that are protected, that have actually been tried and tested, and that's the information that you need to have, really, and those are questions you need to ask.
Absolutely, but like I say, there are masks you can make yourself, just to protect, for public protection, really, where we're out in the public and we want to protect ourselves from the public and we want to protect the public.
Yes, that's great. So our next little snippet will be on public protection.